I'm Dr. Chizobam Idahosa. I'm a clinical associate professor at the School of Dental Medicine, University of Pennsylvania, as an oral medicine specialist. Salivary glands are essentially glands that produce saliva, which is the clear liquid that we have in our mouth. We have salivary glands, three main types, and then we have some other minor salivary glands. So the three main salivary glands we have are the parotid glands. Those ones are located just in front of the ears by the sides of the face. And then we have two submandibular glands that are beneath the jaw. And then the sublingual glands are kind of found under the tongue. And saliva essentially is, the clear liquid, and it has a lot of functions in the mouth, such as, making the mouth lubricated so that we can speak and then we can eat. And saliva also has like antibacterial properties so that we don't get like oral infections. The salivary glands, a lot of things can affect the salivary glands. The most common, I'll call it a disease that affects the salivary glands, is when you have limited production of saliva. That means when patients have dry mouth. So dry mouth, the clinical term is xerostomia, is when the salivary glands are not producing enough saliva for a number of reasons. I mean, there are a host of different reasons that can happen. Sometimes it could just be because somebody is dehydrated, they're not drinking enough fluids, or it could be, something as simple as mouth breathing. But also, dry mouth occurs more in older people. It can occur as a result of side effects of a host, like a lot of medications. A blocked salivary gland can happen with chronic dehydration. So the salivary gland can, if it gets blocked, it can get like tender. That means the area will feel painful. That patient may be able to feel like a lump in that area. It may be just like a small, like a lump they may feel affecting the gland, and it can get painful. It can get really uncomfortable. It can then get infected if it's not addressed soon enough. A salivary gland stone, the name is sialolith, or sometimes people may call it salivary calculus, but essentially sialolith is the name. And it can, like, the substances, the minerals and stuff in the saliva can kind of like, crystallize and like form that stone that will block the flow of saliva in the duct being the tube that's, the passageway for the saliva from the gland into the mouth. So each salivary gland has like tubes, those are the ducts that help to allow the saliva to flow from within the gland and empty into the mouth. The general tips that we give people that have dry mouth is to learn to have like a bottle of water all the time, and to learn to sip water frequently. It doesn't mean that you're going to drown yourself in water, but have a bottle of water with you all the time so that you can sip frequently to keep hydrated and keep your mouth from drying out. Try not to use like mouthwashes that have a high content of alcohol that tend to dehydrate the mouth further. And also you want to limit like lots of heavy spices in the foods, because that can make the mouth more symptomatic. If your mouth is feeling excessively dry at night, it might help to use a humidifier.